Welcome to our in-depth exploration of cardiovascular diseases, CVD. In this new series in the channel, we will give a complete and detailed summary on common disorders of cardiac function. If you would like to review aspects about normal cardiac function, feel free to take a look on our YouTube channel, where is already a complete playlist about it. Well, remember that for this series, we are using as main source Porth's Pathophysiology book, 9th edition. Specifically, we will be focusing on Chapter 32, Disorders of Cardiac Function. In the past videos, we talked about the first part of the section, Disorders of the Pericardium of the Chapter 32. We mentioned some generalities, the main classification, and we talked in detail about acute pericarditis. Definition, pathogenesis, clinical manifestations, diagnosis, treatment. And in the second part, we talked about pericardial effusion and cardiac tamponade, pathogenesis, diagnosis, and treatment. In this opportunity, we are going to focus on the third and last part of this section, disorders of the pericardium. So basically, we're going to talk about constrictive pericarditis, etiology, clinical manifestations, diagnosis. Let's begin. Constrictive pericarditis. In constrictive pericarditis, a fibrous calcified scar tissue develops between the visceral and parietal layers of the serous pericardium. In time, the scar tissue contracts and interferes with diastolic filling of the heart, at which point cardiac output and cardiac reserve become fixed. The equalization of end diastolic pressures in all four cardiac chambers is the pathophysiologic hallmark of constrictive pericarditis. Effusive constrictive pericarditis, a combination of effusion, tamponade, and constriction, is a syndrome that develops in a significant number of people with pericardial disease. Because it occurs most often during a subacute or chronic course of pericardial disease, it is most likely due to a transition from acute pericarditis with pericardial effusion to constrictive pericarditis. It usually is detected when hemodynamic measurements fail to stabilize after pericardiocentesis. There are many causes, but the most common is idiopathic, with the exception of possibly caused from malignant disease, radiation, and tuberculosis. People with the disorder usually require pericardiectomy. Etiology and clinical manifestations. Long-standing inflammation from mediastinal radiation, cardiac surgery, or infection is usually the cause of constrictive pericarditis. Ascites is a prominent early finding and may be accompanied by pedal edema, dyspnea on exertion, and fatigue. The jugular veins also are distended. The Kussmaul sign is an inspiratory distension of the jugular veins caused by the inability of the right atrium encased in its rigid pericardium to accommodate the increase in venous return that occurs with inspiration. Exercise intolerance, muscle wasting, and weight loss develop in end-stage constrictive pericarditis. Diagnosis. Chest radiography and Doppler and transesophageal echocardiography are helpful in the diagnosis of constrictive pericarditis. Doppler echocardiogram and cardiac catheterization are especially useful in the differentiation of constrictive pericarditis from restrictive cardiomyopathy, as are computed tomography, CT, and magnetic resonance imaging, MRI. In chronic constrictive pericarditis, surgical removal or resection of the pericardium, that is, pericardiectomy, is often the treatment of choice. Thank you for joining us in this first section of a detailed exploration of disorders of cardiac function. This video is just the beginning of a series of videos coming about the most common cardiovascular diseases related to Chapter 32 of the book, Porth's Pathophysiology, 9th edition. Stay tuned for more informative content, not only in pathophysiology, but also in other fields of medicine. If you found this content useful, please like the video, share it with others, and subscribe to our channel. Don't forget to activate the notification bell to stay updated on all our latest content.